I'm 26, I'm getting there, I'm heading towards 30. How could I retain healthy skin and lips?
Clinically, what a lot of people are not aware of, there are only 2 active ingredients that clinically have been proven to have an anti-aging effect. So those 2 ingredients are the one best thing that anyone can do to ensure that they have good skin and the skin continues to look healthy and young as they age.
It was quite shocking the amount of people that have had cosmetic procedures in foreign countries and they've gone wrong.
So, albeit that it is not a prescription medication, it is a substance that can potentially cause catastrophic, permanent disfigurement.
You've just blown my mind. I think that so many people just assume that because they're getting a filler or because they're getting some kind of cosmetic procedure that they would have a license.
And including those who are not medically trained have been allowed to provide dermal fillers procedure to just about anyone.
Dr. Kieren Bong is a world-renowned cosmetic doctor. And in this podcast, he's going to go over the dangers of cosmetic procedures, especially getting them done overseas at an untrustworthy source. But also the ins and outs of what he does. What actually is Botox? What is the liquid they use? How long does it last? All of this information is in this podcast. This is the Into the Mind podcast. And my name is Harrison Brown. If you're watching or listening, I hope this helps. So, Kieren, thank you so much for coming in.
No, thank you for having me. Very good afternoon.
Yeah, you too, and I appreciate it, man. I was having a wee stalk of your Instagram, and it was quite shocking the amount of people that have had cosmetic procedures in foreign countries and they've gone wrong. And what is the kind of worst stories that you have about cosmetics going wrong in these maybe foreign countries or non-trusted clinics?
Yes. We're seeing a high number of patients who go to different countries in predominantly in eastern part of Europe and have procedures and have suffered complications, unfortunately. I personally think it's a lot to do with the fact that potentially language barrier is a factor, in a sense that when it comes to cosmetic procedures, it's important for the patient whose vision align with the person they're consulting with. I would like to think that those surgeons and doctors in those countries are very well trained and very experienced, but a lot of the some of the reasons I personally think is as a result of the fact that the patient's vision is not aligning with the surgeon or the doctor that they're consulting with. But whether it's cosmetic surgery or cosmetic medical procedures, there are always risks of complications. And my personal opinion is that some patients fail to appreciate those risks. Mm-hmm. And there is nothing wrong with having procedures carried out in foreign countries because those surgeons and doctors are very well trained themselves, and I would like to think that have extensive experience as well. But the risks associated with those procedures are probably not conveyed to patients, and some patients perhaps maybe fail to appreciate that these risks, if they were to unfortunately suffer those complications and they are physically in the UK, it can be tricky for doctors in the UK to understand exactly what they have had, and the complexity of the procedures that they've had in those countries. But the bigger picture is such that in the UK, particularly in the non-surgical arena, if you like, is that the lack of regulations is such that we have seen proliferation of providers, particularly in the non-surgical side of cosmetic. We refer that to cosmetic medicine or cosmetic dermatology or facial aesthetics procedures. We have seen over the past 10 years or so that there has been a proliferation of providers, if you like, of all sorts of backgrounds. Specifically when it comes to non-surgical and injectables such as Botox and fillers, in the UK, unlike many countries in Europe and throughout the world, UK doesn't really have a specific regulation targeting the non-surgical industry specifically. So we are seeing providers of from non-medical backgrounds offering injectables such as Botox and fillers. And this trend is unfortunately progressing, and we are seeing this high number of providers without proper training, proper medical background, offering these procedures. And unfortunately, the general public is also not aware of the fact that these procedures are medical procedures. One example I can give you is a lot of people are not aware of the fact that Botox or botulinum toxin is a prescription medication. When they're consulting with somebody who is offering botulinum toxin, this person has to be A, a clinician, B, a clinician who has a license to prescribe a prescription-only medication. But Botox is such a household name that many members of the public are not aware of the fact that it's a prescription medication. And apart from the fact that it's a prescription medication, it is also a medical procedure. Dermal fillers, for example, is such a popular treatment. And dermal filler, albeit that it's not a prescription medication, but it is classified as a medical procedure. Yet, a lot of providers are not medically trained. So this is when the confusion is such that general public is not aware that they should perhaps maybe do their research and do their homework before they approach a provider. The complexity of the situation is such that in the UK, the action of the action of injecting is not as I'm probably not explaining this very well. So the action of the carrying out a procedure that involves injection is not illegal if you're not medically trained, as long as the person who is receiving that injection is aware that you are performing the procedure and you do not have a medical background.
I get it. So you think the UK's regulations isn't strict enough when it comes to non-authenticated or non-medical personnel carrying out these kind of tricky procedures?
Yes, totally. So a simplified example I can give you is that if you think about amoxicillin, which is a very commonly prescribed antibiotic, it is a prescription medication, it is a form of antibiotic. And if a person who is a non-prescriber, a non-clinician, is selling amoxicillin, that person is committing a criminal offense because that person is not a clinician and that person is not a licensed prescriber. So by virtue of the fact that that person is selling amoxicillin, that person is committing a criminal offense. So the same principle should apply to botulinum toxin because it's as simple as that. Botulinum toxin is a prescription medication. And therefore, whoever is offering botulinum toxin without a medical background and without a license to prescribe should and is committing a criminal offense. But unfortunately, because of the popularity of botulinum toxin, patients are not aware of the fact that it is a prescription medication and therefore they should have the procedure carried out by a clinician who has a license to prescribe. Now, you're going to ask, so how do these people who are not clinicians and have no license to prescribe procure their botulinum toxin?
Read my mind.
The situation is such that a lot of these providers are able to import them from different parts of Europe or outside Europe, and there are some online sellers who sell directly to these non-prescribers as well. So the lack of regulation and the lack of enforcement is such that it's allowing these non-clinicians and non-prescribers the opportunity to procure these medications and offer these procedures. So this is when this is when I find it puzzling and rather it's difficult to to justify why there is no such enforcement, because if somebody was to be providing COVID vaccine without a license to prescribe or without being a clinician, that person would be apprehended. But if the person is offering botulinum toxin, which itself is also a prescription medication, that person seems to be able to get away with it. So I think it's because of this kind of lack of enforcement and lack of regulation that is allowed the industry to develop into the way it is now. With regards to dermal filler, albeit that it is not a prescription medication, dermal fillers are substances which are injected into the tissue to create shape, volume, as well as contour. But equally, by virtue of the fact that it is a substance, it's a physical substance, it can also be accidentally injected into blood vessels. Oh. And if that was to happen, it can potentially block the blood vessels and deprive that area of the tissue of oxygen. And that specific part of the tissue can potentially sustain prolonged oxygen deprivation to such an extent that the viability of the tissue can be permanently and adversely affected. So albeit that it is not a prescription medication, it is a substance that can potentially cause catastrophic permanent disfigurement. So the lack of regulation is such that the providers of different background and including those who are not medically trained have been allowed to provide dermal fillers procedure to just about anyone. And this is when we, the clinicians, find it difficult to comprehend why that has been allowed to progress to the way it is today. A lot of people argue that, especially those who are not from a medical background, they argue that they are just as good at performing the procedures as the ones who have medical training. And also medical training itself does not necessarily mean that that person knows how to carry out an aesthetic procedure. But it is more complex than that. That is an oversimplified way of looking at a medical procedure. If I may give you a couple of examples, if a patient, when I'm consulting with a patient, if a patient is on a medication, perhaps maybe, let's say, methotrexate, which is a medication that's commonly prescribed for people with rheumatoid arthritis, a doctor like myself, I would take that into consideration, because when you have a foreign substance injected into somebody's body that consists of hyaluronic acid, which is what the dermal fillers, majority of them are made of, I will keep it in mind that 1 in 10,000 people, they may potentially find that their tissue will not like the dermal filler that's sitting there. So I will keep that in mind just by looking at the medical history of a patient. So the procedure is not just a procedure. A procedure to a clinician is more than just a procedure. Or if a patient was to be on perhaps maybe 2 antidepressive medications, a clinician like myself, I would immediately think it is likely that this person may potentially have severe depressive illness or a history of severe depressive illness, because in general, people who are on antidepressant medication, if they were to be on 2, that can only be prescribed by a psychiatrist, not a GP. A GP can prescribe an antidepressant medication, but just one type. But if a person is on 2 antidepressants, is an indication that the history of depressive illness is probably on the severe side. And that would have been prescribed by a psychiatrist. Or some non-medical providers argue that the clinicians argue that these are medical procedures and clinicians should be the ones who perform these procedures because it requires an acute understanding of human anatomy. But non-medical providers argue that they learn anatomy as well, and they are familiar with facial anatomy as well. This is when I personally think a lot of people get surface anatomy confused with applied clinical anatomy. And if I may give you a more technical example about that is, so when I'm injecting somebody's top lip with dermal filler, I will have it in my mind that I will make a mental map. I will divide the one side of the top lip into three sections. So you have the inner 1/3, middle 1/3, and outer 1/3. And I will say to myself that 68% of the blood vessels would go from the skin above the top lip into the top lip at the junction between the outer 1/3 and the inner 1/3. So I will try to avoid pointing the tip of my instrument at that very junction, because then there is a risk of me placing the filler accidentally into that blood vessel. And I will also look at the border between what we call the wet-dry border. Our lips are such that you have the wet part and you have the dry part. The dry part is where you are able to see from the outside. So a lot of the 3/4 of the blood vessels are found to be behind the wet-dry border. So when you're pointing an instrument, when you're injecting in somebody's lips, a clinician who has been trained well and has the necessary experience would know that 3/4 of the blood vessels are sitting behind the wet-dry border, and therefore you will want to avoid pointing the tip of the instrument behind the wet-dry border, because you're increasing the risk of accidental injection of the filler into the blood vessel unnecessarily.
And that would stop the blood flow to that part of the lip?
Yes, yes. So this is what I call applied clinical anatomy. So applied clinical anatomy is very different from surface anatomy. Surface anatomy is you are able to name the different anatomical structures. So those are surface anatomy, but applied clinical anatomy is different. And I think fundamentally this is when the disagreement between clinicians and non-clinicians arises. Providers who without medical training argue that they are able to perform the procedure just as well as, or they understand anatomy just as well as medically trained clinicians. But that's because they don't realize that, there is a difference between surface anatomy and applied clinical anatomy.
That you've just blown my mind. I think that the law being so loose around these fillers and different procedures, cosmetic procedures, I never knew that before. I think that so many people just assume that because they're getting a filler or because they're getting some kind of cosmetic procedure that they would have a license. But what do you think the percentage is in terms of people that are doing these procedures that don't have a license comparison to do? Chisholm Hunter are the sponsors of the Into the Mind podcast. And without Chisholm Hunter, I would not be sitting here today. So I need to take the time just to talk about them for 2 seconds. They specialize in luxury watches and luxury jewelry. And they've actually been going for over 165 years, which is pretty damn old. They're also family run, which is a really rare thing nowadays. So if you're looking for a luxury watch or a luxury diamond, head to chisholmhunter.co.uk. That's chisholmhunter.co.uk. And with that said, back to the podcast.
Oh, to be honest with you, I don't know, because we are seeing more and more people from a non-medical background offering these procedures, particularly in the UK, and so I really don't know the statistics because, and that's I think another issue with what we are seeing in the non-surgical industry is that because of, for the doctors and the nurses and the dentist, we are legally required to be registered with, for the doctors, General Medical Council, and nurses, the Nursing Council, and then the dentist, the Dentistry Council. But non-medical providers are not required to be registered with anyone because there is no such register for them. So statistically, it's very difficult, if not impossible, to know how many providers from non-medical background, and that can potentially be an issue when a patient is confronted with complications. And I have seen many cases of patients having come into contact with a provider over Instagram, and many non-medical providers have only Instagram profiles and a mobile number instead of having a physical premises and a proper website. And so when a patient is having difficulty with their procedure and is trying to raise their concern with a provider with only a social media profile and a mobile number, I have seen cases that the provider would block this patient from having access to their social media profile and would then block their mobile number, block the patient's mobile number.
Wow.
And because the provider, who is a non-medical one and who does not have a register, or an oversight body, if you like, this patient has no other ways of getting help from this provider. Whereas a clinician has an overriding duty of care, and that is ultimately what oversees our practice, that we have this overriding duty of care. We have an oversight body that would regulate the conduct of clinicians, and so if a patient was to have any concern regarding their procedure, we are legally obliged and ethically obliged to have to attend to those concerns. So I think those are just examples of why it is not just as straightforward as, okay, you want to have either Botox or filler, look up Instagram, look at somebody's Instagram profile, and then get in contact with them and then go to them. A patient has to do their homework, do their research, think carefully about the fact that these are medical procedures with potentially permanent, with complications that can potentially be catastrophic. I'm not saying that, that's not to say that these procedures are risky and dangerous. When they are performed correctly and performed with proper training, these procedures can be transformational. A lot of our patients, so different people come to us for different reasons, albeit that it is referred to as a cosmetic procedure, it is not always about the cosmesis or the aesthetics element of the procedure. We can do so much now with non-surgical facial aesthetics procedures. Like, I see significant number of patients who have had perhaps maybe an appearance of their noses that they are not happy about. They've had trauma in the past when they were young, growing up, cycling, falling off their bicycle, and they have dents in their nose. So we can use dermal filler to smoothen out the contour of the nose and the appearance of the nose for them. So it is, or we see patients with asymmetry. The asymmetry can be such that they are self-conscious about it. So it's not always about wrinkles and lines and about making somebody more beautiful.
Interesting. Social media is a really, really scary thing, and I think it's especially scary when it comes to the younger generation. And I think one key feature on social media that I find very terrifying, especially for younger people, is filters. And if you're looking at social media 3 hours a day, you're all good. And if you're looking at social media 3 hours a day, and you've got this beautiful smooth skin and it makes you more symmetrical because it's a filter, that will become your reality. Have you seen an increase in younger people coming in because of these kind of filters that have been applied through social media?
Yes, it is not uncommon that I see patients who come in that describe what they're looking for, and then they pull out their phones. Yeah. And then they pull out their phones, and then they show you either a picture of someone else that they would like to perhaps maybe not the word copy is not the right word, but they have seen pictures on social media that they like, and they would like to use those pictures to illustrate what they are talking about, and hopefully we can recreate some of the results that they are looking for. Or they pull out a picture of themselves and they are trying to illustrate the fact that this is the aspect, that specific aspect of them that they don't like, and then another picture, these are the aspects of themselves that they like. What I think they don't realize is in order to get that 1 or 2 pictures, they probably have taken 30 pictures of themselves and then pick 1 or 2. So the way I consult with them is that, particularly if it's an aspect of themselves that they don't like, I always just say to them that that very picture is one that you might have picked out from maybe 20 to 30 pictures, but when you're interacting with somebody in real life, people don't get that. People are not studying your face in such a way. People are not scrutinizing and examining your face in that way. For instance, I can have a patient who describes, okay, they look at me, they raise their brows, and they say, can you see one side of my brow is not as high as the other side, so there is an asymmetry there. And then they document that in a picture. But I always say to them, when you're interacting with somebody and when you're enunciating, you don't hold your brows up like that. But when you're trying to document that asymmetry, you are mimicking that expression, and you hold that expression there just so that you can take a picture of it and document it. But in real life, we don't interact with people that way. We don't hold our brows up that way. So the majority of people who interact with you are unlikely going to notice this asymmetry.
Yeah, and I think people scrutinize themselves so much because of social media, because of pictures, because of editing apps, because of the fakeness of everything. And I think something that's quite good about your social media, if I may say, is that you kind of document cases in perhaps different places that have gone wrong and how you can fix them, and how that the other people or whoever's carried out the procedure has done it wrong. And that's quite, just thinking about my kind of career, I've had to look at myself in front of a camera for so long that I've kind of grown numb to it. But I do remember at the start, and you remember this as well, Drew, was my hair and my nose, and is the lighting right? And you do get kind of infatuated by the way that you look, but you would look at me and you'd be like, you're absolutely fine. What are you talking about?
Yes. So it's not uncommon. I ask my patient, especially if they are consulting with me in the presence of their spouses or their friends, because occasionally I do, well, actually quite frequently I see patients who come in not just by themselves. They come in with a friend, or they come in with their partner. And it's not uncommon that I would turn to the partner and ask the partner, what do you think? Have you ever noticed that? And if the partner was to say, no, I've been telling her that, I don't know what she's talking about, it's not uncommon, I would say to the patient, as you can see, it's exactly like what I've talked about, that people don't examine your face that way when they are talking to you, when they are interacting with you. But that's not to dismiss their concern, because it's important to have a balance when you are consulting with a patient, that it is, it's all about listening to them and ascertaining what their concerns are, and rather than being dismissive about it, because as part of our assessment when we are consulting with a patient is we think about if this is potentially an issue for them, and an issue big enough that they might potentially need other help. And also as a clinician, it's about ascertaining if there is anything else we can do other than an aesthetic procedure to address these concerns. And some of these concerns can be addressed pretty easily by just us affirming to them that there is nothing wrong about it. It's okay to be not symmetrical. It is okay to, when you smile, one corner of your mouth goes up higher than the other. So sometimes just by telling them that, it is enough to settle their mind and enough for them to move on, if you like. So not everything requires corrective procedures. Not everything requires an intervention. So that's how I consult with my patients. I listen to them first, and if something that I can help, and I think that, okay, well, it sounds like it is something that can be corrected or improved, if you like, not necessarily correct, but as in not every procedure is about correcting something. So sometimes it's just an improvement that they are hoping to achieve. And we always weigh out the risks and benefits of performing a procedure, because if the risks outweigh the benefit that they are likely going to gain, then as a clinician we are ethically bound to not perform that procedure, or at least convey that to the patients, and ultimately they will need to make an informed decision about whether they would like to have that procedure or not. But sometimes it just by telling them that, yes, I can see the asymmetry, yes, I can see the imperfection in the skin quality, but there is nothing wrong with that. There's nothing wrong with that. And it's not uncommon. I use myself as, the subject. I would say to them, look at me. When I smile, the corner of my mouth, one side goes up higher than the other. And you look at me, I have a lot of pores on my skin. I have oily skin. I've grown up with it. I grew up with acne. I've been on Roaccutane twice. And I'm very, upfront with them that, and sometimes using myself as an example, and it allows them to relate to the fact that having some imperfection in life or in your appearance, it's not a bad thing.
And I think we see it as such a huge deal. For example, if I were to have a spot on my face, that is the center of my universe, and I'm so annoyed that I have this spot in my face, and I think that everyone's staring at said spot.
Yes.
But 99% of the time, everyone just goes, I don't really care. He's got a spot on his face, then that's okay. And I think that you're probably doing it in the right way. And it was actually following on to another question that I had for you in terms of giving both options. Like, listen, here are the risks, but we could potentially do this. I think that if you were to go to an unlicensed clinician that does these kind of procedures, they would more be inspired by the money that they can get rather than actually the ethics behind the procedure. And that's kind of the next things I was going to ask you. In terms of the ethical side of things, do you think that because this can have such a huge impact on people's confidence and the way they feel, that it's probably the right thing to do? Or do you think that, I don't know, I feel like we're maybe going so far down this path of altering facial structure, or altering hairlines, or altering ears, altering liposuction, that's becoming the norm. And that's a little bit more scary, because young children will compare themselves to people that have had this work done. What are your kind of views on the ethics of it?
Yes. Now, so if I may, if let's say if I was to remove myself as a clinician, right? Mm-hmm. And so if you think about it, the dental procedures, cosmetic dentistry, such as veneers or crowns, we take away a layer of the enamel when just before you have the crown or the veneer fitted, and that is a permanent loss because you won't be able to grow the enamel back. Yet a lot of people don't think twice about getting veneers or having a crown. So that's how much the society's mentality with regards to cosmetic procedures, and in this case, cosmetic dentistry, has changed, that people no longer see that they are actually causing permanent harm to their dentition that can never be replaced. So that's how much the shift in the society's perception about a procedure can change over time. We live in the 21st century now, particularly with the influence of social media. It is unfortunately the way it is now that we are more than ever more aware of appearance, and more emphasis is placed on physical appearance. I think the balance is where having intervention but not overdoing it. So when I see a patient, I classify them in a way into 3 categories. One is correction, second is beautification, and number 3 is a combination of both. So correction is one that, so for instance, if somebody was to come in to see me, they have moderate to severe what we call photo damage. So photo damage refers to damage of the skin, cumulative damage of the skin over the years as a result of exposure to or excessive exposure to the sun. And that can manifest itself in the form of moderate to severe lines and wrinkles, saggy skin, brown spots, sunspots. So if somebody has sunspots and brown spots causing uneven skin tone and they are self-conscious about it, or they're self-conscious about smoker's lines, for example, and smoker's lines can happen in people who are not smokers. So we most of the time refer to them as vertical lines.
What are smoker's lines? Is that
smoker's lines are those static wrinkles that you see above the top lip.
Right.
And most of the time you see them in women. Men, it's not common that men see or get smoker's lines. But it's predominantly women who get very self-conscious about it. So if they have those smoker's lines, they can feel quite self-conscious because they think it's very aging for them. And then when on a Friday night, for instance, when they're having dinner in a restaurant, and invariably the lightings will be fairly dim and the background will be pretty loud and noisy, they think the person they are having dinner with is lip reading and focusing a lot on those lines. And they get quite self-conscious about it. So if they come in to see me for that, I will put them in the category of they are looking for a correction. So they want those lines softened and corrected. It's a tangible improvement that you are achieving for them. So they fall into the correction category. But you have some patients who are coming in, they have beautiful lips, they just want a little bit of enhancement to the shape of the contour of the lips, because it's part of the aging process that we lose volume as well as we lose the definition in our lips. But they don't necessarily need that corrected. It's just marginally thinner than a few years ago. So this is when they are looking for that procedure to enhance their appearance, to beautify their appearance. So they fall into the beautification category. But most of our patients, when they get to their 40s or 50s, they fall into the third category, which is partially correcting something and partially trying to improve their appearance. So, for instance, volume loss is part of the aging process, and we start losing volume. We start to age from the age of around about 30 years old. And one of the signs of aging is we start losing volume in the middle part of the face. So the cheeks start to lose the definition or the plumpness. And that, then translates into the appearance of sagginess in the lower 1/3 of the face, and jowliness. So I describe that as, a phenomenon such as, it's akin to a balloon losing volume. So when somebody comes in their late 30s or early 40s, for instance, they will have lost a small quantity of volume. So all they need is a little bit of replacement of the volume plus a slight introduction of definition and shape into the cheeks. So that requires a small degree of correction, i.e. volume replacement, and then a small degree of beautification, i.e. you introduce a little bit of definition and shape into the cheeks. So most people fall into that category. But it's about striking a balance, I think, because we live in the 21st century now. A lot of my patients would say they don't want to grow old disgracefully like that. So the acceptability of cosmetic intervention is such that a lot of people perceive that as almost a part of self-grooming, not dissimilar to them getting hair dye, getting veneers, getting dental crowns. They see that as part of just being in a society where physical appearance is an important element of human interaction. And so the way to approach that mindset is making sure that one doesn't overdo it, because anything in moderation is considered acceptable, isn't it? It is only when you overdo it and there is quite a skewed, almost pathological approach to cosmetic intervention when it gives this industry a bad name, that we see overfilled lips, people who have had such a high dose of Botox and in such frequency that they have almost zero expression, or people who have overfilled lips, or they've had laser resurfacing so frequently that they look like a wax model. So I think it is when the balance is skewed towards overdoing. This is when that person perhaps maybe need to be reminded that they need to be careful with what they are doing to themselves.
For sure. And what actually is it permanent when you do the either the lip fillers or the Botox, or is that semi-permanent or?
Yeah, so fillers are classified into non-permanent fillers, semi-permanent, and permanent fillers. If you wind the clock back probably 25 years ago, permanent fillers were the most popular choice of substance. This is because back then it's either you go for permanent fillers that would give you the longevity you're looking for, or you go for the non-permanent, which was collagen at the time. It was very, very popular back then. But collagen, the biggest disadvantages of collagen were that one, it was manufactured from an animal source, so predominantly pigs. And then second is the lack of longevity. So it being an animal-based product, it meant that it shared some protein, i.e. DNAs and protein with human being. So an animal-based products would then come with the risk of allergy. So historically, back 20, 30 years ago, a patient would have to come into the clinic, have a patch test, and would have to then go away for 24, 48 hours in order to ascertain if they are allergic to it, and then return to the clinic to have the procedure. So that itself was inconvenient, was a form of inconvenience. And then the risk of allergy was high enough to put off a lot of people. And it being manufactured from pigs also meant that a massive segment of the society, i.e. the society from the Muslim background, would have been excluded from having that procedure. But one of the reasons why collagen is not easy to find nowadays is because of the lack of longevity. So back then, collagen filler would last if you're lucky, probably 3 to 4 months.
Really?
So not a long time. And it was costly, and you would only get 3 to 4 months of the result out of it. So came probably 20 years ago, the scientists discovered this molecule called hyaluronic acid. It is a molecule that you see a lot in skincare products. It's the holy grail of skincare product, and the primary function of hyaluronic acid is it has very high affinity to water. So hence your skincare product cannot do without it, because if you have hyaluronic acid in your topical skincare, you apply it onto the surface of your skin, it attracts water. It has very high affinity to water. Each molecule of hyaluronic acid can attract up to 1,000 times its molecular weight of water. So it attracts water towards itself. It plumps the skin, the wrinkles and the lines, and the pores then seem smaller and less noticeable. So that's the principle behind hyaluronic acid-based moisturizers. And so hyaluronic acid then, the scientists started to put hyaluronic acid into syringes, and the hyaluronic acid would then be injected into somebody's tissues, and it would then, over the following a week to 10 days, attract water towards itself. And that's how it sustains the result. And hyaluronic acid is manufactured from bacteria, so it's no longer manufactured from a DNA-based animal source. Hence, the risk of allergic reaction associated with hyaluronic acid filler has pretty much overall been almost completely eliminated. So it's very uncommon for anyone to require a patch test before they get hyaluronic acid filler. But the biggest advantage with hyaluronic acid filler is it is reversible. And that's also one of the reasons why it has grown in popularity to such an extent in such a short space of time, is because now you have a product that doesn't need patch testing. You have a product that can last anywhere between a year to 3 years and is reversible. And you see the results straight away. So it's almost like perfection. So you get full control over the result. Patient is sitting in a chair, you perform the procedure, they get to see the result straight away, and they get to guide you sometimes as to what kind of result they are hoping to achieve. And it's safe enough that if they don't like it, they have the antidote for it, so to speak. So it's almost like the best of both worlds.
And does the antidote just dissolve?
Yes, so the antidote is a liquid medication, it's an enzyme. And you inject the enzyme into where the filler sits, and within 24 hours, almost 100% of the filler disappears.
Wow! And is there any fallout to that? Because I know that the lip obviously increases in size, meaning the skin around it also increases in size. So if you were to expand the lip and then take away the filler, would it be a bit saggy?
Yeah. So it's a logical deduction. Remember we spoke about everything has to have a healthy balance, right?
Yeah.
So it's important to not overfill the lips, because the mucosa will have been stretched over a lengthy period of time. So if you overfill the lips and then you dissolve it, understandably, as your logic, very rightly so, it would suggest that person may potentially be left with a degree of laxity of the mucosa. So it's important that people don't overfill their lips and overfill other parts of the face, because it can potentially stretch the mucosa enough that when one day, if you decide to not have filler, you might potentially be left with a laxity. But fortunately, our human skin and human mucosa are pretty capable of contracting. So as long as it's not horrendously overfilled and not over a very lengthy period of time, most of the time you should be able to give it long enough for the skin or the mucosa to contract. But there is another negative consequence with overfilling, let's say, the lips, is that we have glands in our lips to keep our lips moisturized. So what a lot of people are not aware of is, hence, it is, non-surgical injectables are medical procedures, is because if you stuff the lips with horrendous amount of filling agents, if you like, and in this case is hyaluronic acid, you may potentially squash those glands. And so patients can potentially have impairment of the function of these glands when one day, if they choose to not keep up with the overfilling, or if they need to have the filler removed, because these glands have been squashed for a lengthy period of time. They may not necessarily be able to recover their activities back. So these are the things that a clinician is likely to consider, because a clinician doesn't perceive a procedure as just a procedure. There are a lot of other considerations that a clinician has to make beyond sticking a needle into somebody's tissue.
Yeah. How do you think that people can retain healthy skin and lips in the aging process? I'm 26. I'm getting there. I'm heading towards 30. How could I retain healthy skin and lips?
I was looking at you earlier, and I was saying to myself, you are one of those fortunate ones that genetically you might be 120 years old but look 25. And yes. So we start with the skin. Is in the one thing that anyone can. The one best thing that anyone can do to ensure that they have good skin and the skin continues to look healthy and young as they age is sunblock. So use sunblock on a day-to-day basis, even when they are indoor. And I think that's when people don't realize that even when you are indoor, you still get exposure to rays that can potentially age you. Now, so a lot of people don't realize that UV rays can go through windows. And the example I give them is, if you put a leather couch next to a window long enough, a couple of years, the leather couch does age. The quality of the leather ages too. That's because UV rays can go through windows. And our computer, ceiling lights, these have infrareds. And infrared rays can also age the skin as well. So even when you're indoors, sitting by the window, staring into a computer, cumulatively over many, many years, you're exposing your skin to these rays that can age your skin. So even when you're working indoor, it's important to use sunblock. And then some of our lifestyle choices, like cigarettes, smoking and alcohol, if one can consciously reduce the consumption of these substances, then that can help with maintaining the quality of the skin for as long as possible. And then sun exposure is another one. And again, when people are on holiday, they don't use enough sunblocks. They don't use it frequently enough. A lot of people think just by applying it at 7 o'clock in the morning, they can then go wander around the city for the entire day without having to reapply the sunblock. Or people who are walking on the beach for miles and miles and miles when they're on holiday, they don't realize that the reflection of sun rays off the water, that can, that is like a magnifying glass. Because the rays are being reflected back onto your face. They think they're sitting in a shaded area under a little gazebo, but by the swimming pool, but they don't realize that the water in the swimming pool is reflecting back the UV light. So you may be in a shaded area, but you're still exposed to UV light through reflection of the tiled floor, of the water in the swimming pool.
Wow.
So they are not using enough of the sunblock and not frequent enough. So those are the things that they can do to help, but it has to be a sustained effort. It's not the case that you only apply sunblock when you're on holiday. It has to be every day when you're driving, when you're sitting in your office, and then use good skincare product. And good skincare products don't necessarily have to be costly. And that's another fallacy, if you like, that a lot of people think they have to use the most expensive skincare products. But clinically, what a lot of people are not aware of, there are only two, in general, I'm speaking in general here, there are only two active ingredients that clinically have been proven to have an anti-aging effect. Most of the other ingredients do not have anti-aging effect. They have tangible result, but they are unlikely going to provide cellular change with an anti-aging effect. So those two ingredients are retinol, i.e. vitamin A, and vitamin C. So if anyone was to invest in topical skincare products and they don't want to spend a lot of money on these things, all they need to do is make sure that these two ingredients are in those products. Having said that, it is more complex than that. Sometimes, oversimplification of something, especially oversimplification of science, can be dangerous. So having said that, it also does cost a little bit of money to have skincare products that work. So vitamin C, for instance, I mentioned that vitamin C is one of the two most important ingredients. But vitamin C is both temperature sensitive and motion sensitive. And also is very sensitive to oxidation. So if you buy a tub of topical cream that costs £9.99, for example, over the counter, and it proclaims to have high concentration of vitamin C, studies have shown that you open that tub of cream twice a day, right, morning and evening, and then you leave it there for about 3 minutes while you apply a small blob of it onto your face. Within almost a week to 10 days, sometimes some of those brands, actually over 90% of the vitamin C will have been oxidized within a week to 10 days.
So it's just not effective after that?
Yes, because it's sensitive to oxidation. And on the subject of it being sensitive to motion and temperature, if you have a tub or a serum, vitamin C rich serum, and you shake it like tequila, you put it into your handbag, your gym bag and all this, and you shake it like a tequila, a lot of the molecules will have ruptured within that short space of time, and they will be ineffective because it's motion sensitive. Or you leave it in your gym bag, and your gym bag is sitting in the back of your car, and in a temperature like this is -3 at nighttime in your garage. Those molecules will have been exposed to sub-freezing temperature. And so that type of cream is not going to give you the kind of effect that you think it's going to give you because it's temperature sensitive. So manufacturers, some of the vitamin C serum are expensive because manufacturers understand that it is motion sensitive, temperature sensitive, and sensitive to oxidation. So they can manufacture the vitamin C molecule in such a way that, to give you an example, they can incorporate stabilizing molecule into the overall molecule of the vitamin C serum. And the stabilizing molecule then provides stability to that vitamin C molecule and allows it to withstand motion far better. And some of the molecules can be designed in such a way that it allows the vitamin C molecule to withstand oxidation and temperature much better. But that costs money. And there are some vitamin C serum which the molecule has been designed in such a way that it provides what we call sustained release, i.e. it penetrates through the different layers of the skin and it releases different amount of vitamin C as it goes through the different layers. So this kind of technology costs money. Hence, whilst vitamin C is one of the two most important ingredients, one would still have to, unfortunately, invest a little bit of money into buying vitamin C serum from a reputable manufacturer who has invested the research and development into producing that bottle of serum. So it does cost a little bit.
You have just blown my mind. That is absolutely wild. So I have Bulldog moisturizer.
It's a good brand, yeah. Mm-hmm.
Would it work?
Well, it's I'm sure it must work for it to be such a a popular brand. It's so I would like to think that they would have invested significant amount of resources into the research and development of their products. And also if it doesn't work, then it wouldn't have grown into the company it is today, isn't it?
Yeah.
So I would like to think so. But it's difficult to make a specific comment on a product without seeing the product. But I would like to think that just by it being such a big international global brand, that that I would like to think that they have invested some money into it. Yes.
And what moisturizer do you use?
Well, yes, I keep it very simple. So I'm going to be a bit gender. How do you call it? So I'm going to be a bit gender stereotyping here. I'm a man, right? And I'm in my mid-40s, and I keep it very, very simple, because I'm not I'm not the type, if that's even the word to use now. I'm not the type who has the patience to stand in front of the mirror and apply multiple different layers of skincare products. So although I'm in this industry itself, I also understand that not everyone wants to go through this rather convoluted process of applying multiple things on their face. And I'm one of them. I use, so I'm not trying to promote anything here. I have my own brand of skincare. I came out with my own brand of skincare about 6 years ago. It consists of only 5 core products, because I understand that, and my target market is those who don't want to use multiple products. So it only consists of a cleanser, a day moisturizer, night moisturizer, a face serum, and an eye serum. So just 5 core products. And I use my own products because it's through using these products that I know what I can do with it, i.e. tweaking it moving forward. And so, for instance, my first range of cleanser was a non-foaming cleanser, because at the time I believed, which is true, that sometimes foam in a cleanser can dry the skin, can over dry the skin. So I went for a non-foaming cleanser, but after using it for a couple of years, I realized that non-foaming just simply doesn't give you that satisfaction, if you like, that it's almost as if you've got nothing applied. You're not really cleaning your face, cleansing your face if there is no foam. So I tweaked the formulation of my cleanser after that. So now it is a foaming cleanser. And I also added some a high dose of peppermint into the cleanser, because I also, having used it for a couple of years, I realized that it would, some people do see this as a chore. So if you are able to feel that cooling sensation while they are massaging that foam through their face, it may potentially encourage them to continue with that routine. So that peppermint was introduced into the cleanser just so that they have a more enhanced experience. So I use a very simplified regime, just a cleanser, moisturizer in the morning, nighttime, and serum, and that's it.
I wonder if we get my moisturizer, would you be able to run through to my bathroom? Sure. And there's Bulldog moisturizer there.
I have Cetaphil as well. Do you know Cetaphil?
Yes, it's a medicated brand. Yes,
Is Cetaphil good? Just in my toilet, it will be on where the toothbrush is. Is Cetaphil a good brand?
Yes, it is a good brand. It's you can buy them off the counter. Cetaphil. It's good. good moisturizer. So I usually say to my patients, use anything that that they are comfortable with, that agrees with their skin, because different people are sensitized by different things.
Oh, there we go. Right.
This one's got quite a lot. I don't know.
So we've got Bulldog and
Ceraphil. Were they not in the news?
Were
they not in the news a few months ago? Were they bought over by?
Yeah, I think they were. Would you be able to check that just on your phone? Who bought Bulldog? I'm sure they were.
Yes, they were. I think they were bought over by a big company, Bulldog. Yes. Yep. So as you can see, the three active ingredients, they're very proud of it. So it's on the packaging. You got aloe, which is very moisturizing and very soothing. And also it's anti-inflammatory. So it can be very good for razor burn, perhaps, right? Camelina is, again, just a soothing agent. And then green tea. Green tea is good for firming the skin. Green tea extract. So it's a good product.
So it's good. So that one's good. So what about
so it has to be good because you look so young.
You're flattering me.
No, you look young. You have good skin. I can tell that you don't spend a lot of time in the sun, which is great.
Do you find that people from the UK, this is a separate question, people from the UK, because of the climate, because it's so cloudy, and I mean, we're in Scotland, it's pretty rainy, that they have better skin than those who live perhaps overseas in Australia or the Philippines or somewhere sunny like that?
Well, now, internationally, you probably know through my social media that I'm privileged enough to be invited to speak at conferences internationally, on average, probably like 20 to 30 countries a year. There is this saying internationally that UK people are not skin people. It's just culturally, I think, and again, I'm just generalizing here. Culturally, I think UK people do not emphasize as much on the importance of looking after the quality of their skin as other countries, such as the Nordic countries. And I think the perception of the society with regards to skin quality has a lot to do with it. Now, in the UK, there is this perception that if you look brown, if you look tan, you look healthy. And there's nothing wrong with that. But it is because of that perception that there is this expectation, or this expectation that somebody should always be looking tanned. And hence we see all sorts of very creative ways of looking tan, including spending excessive amount of time in the sun. So the in the UK in general, people like to spend a lot of time in the sun, and their acceptability, with their acceptance level when it comes to having wrinkles on their faces, is also a little bit higher than other countries.
Right.
Yes. I think that's because their perception that looking tan is more important than not having wrinkles on their faces. So they would put up with wrinkles on their faces more than other countries, as long as they look healthy, so to speak.
Which is interesting because any form of tanning is sun damage, isn't it?
Yes.
So you are putting a label of healthy on something that is fundamentally dangerous.
In a way.
That is wild.
In a way, yes, in a way. But you think about it, like back 30 years ago, I have a lot of patients who are now in their 50s. When they come to see me, they always say, if only they knew the damage that they were inflicting on their skin back 30, 40 years ago. Because back 20, 30, 40 years ago, there was not as much education or public awareness with regards to damage that you can possibly inflict on your skin by exposing to excessive amount of sun. So those people back then, 30 years ago, would even apply butter on their skin or baby oil on their skin, in order to look tan or to tan quicker. But they were practically sizzling their skin, really sizzling their skin. So now we see them, and a lot of them would like to reduce the amount and the extent and the severity of their wrinkles. And it's not uncommon, they would say to me that if only they knew what they were doing to their skin back then. So I think the awareness is starting to I'm seeing more and more awareness of the fact that perhaps maybe you don't always need to look tan. And I'm seeing that shift, that you don't always necessarily need to look tan to look healthy. There are other ways to look healthy too.
That's absolutely wild. And I'm actually thinking about this. If you look at actors back in the day, look at Al Pacino, for an example. He was bronzed, and I'm talking golden brown. He looked great, handsome man. But now actors tend to be a lot more natural. I don't want to say pale because it's just more natural. And I wonder if in Hollywood especially, they're more aware of the aging process and they don't want to go in the sunbeds and they don't want to tan as much.
Well, have you heard of Brian Johnson, the guy who's done Project Blueprint? He spent like $2 million to try, or $5 million to try and slow the aging process.
So what's his name? Brian Johnson.
Yeah, Project Blueprint is what he's doing.
So Brian Johnson has, just for the mics, Project Blueprint. And it sits in your face, is that right?
Well, no, he uses a machine to see the UV damage and stuff, and he basically does it's
yeah.
It's really bad.
Yes. So in cosmetic clinics, we have this machine called Visia, and it's a little pod, and not just similar to when you go see your optician that they ask you to rest your chin on a little platform. So there's this machine called Visia. It uses different types of lights of different frequencies, and it can practically see what's in the skin and behind the skin, and we use that to analyze the quality of the skin and give our patients an idea of what they can do to either reverse those signs, or try to do more moving forward to look after their skin. So going back to what you were saying about Hollywood stars, I personally think a lot of it is society's perception about what is acceptable and what is beautiful. Because the opposite is also very true. If you think about in Asia, in the UK or in Europe, but predominantly in the UK, a lot of the skincare products have tinted moisturizer incorporated into them. Right, a lot of moisturizers have some tint incorporated into them. You can get all sorts of very creative topical products that can enhance your tan, preserve your tan, prolong your tan. But in Asia, majority of the skincare products have agents that would lighten the skin.
Wow.
This is because the perception of beauty in Asia is the complete opposite. The paler you are, the more beautiful it's perceived.
And the more affluent, am I right in saying that?
You ask, yes. In general, you're right, because historically, this is very generalized.
Yeah.
So historically, people who work outside were tanned. People who work inside, they were paler, fairer, if you like.
Yeah.
So there was always that perception in the Asian society that you look. It's a reflection of the financial background and social background that you're from, just by looking at your skin. And also it's just over time that it's, the way people perceive how good looking or how beautiful somebody is, part of it is looking at the complexion of the skin. So it's because of that if you have a skincare product that has tanning agent in it, it's unlikely that it's going to sell very well in Asia. So the opposite is the case in Asia.
And is that the same in Scandinavia as well? Because they have the same affiliation to tanning is dangerous.
Yes. So now, I believe it or not, I've been to Norway probably coming to about 48, 49 times now.
Beautiful, isn't it?
Yes, it's gorgeous.
Yeah.
It's I'm affiliated to a university in Norway and a training institute in Norway, and I go to Norway 6 to 8 times a year, and it's been so for about 8 to 9 years now. So I've been to Norway quite a few times. It's practically my second home. So the Norwegians have beautiful skin. The Scandinavians have beautiful skin. You do have a high proportion of Norwegians who go to places like Spain, Portugal, south of France, and get excessive amount of exposure to the sun. But what's interesting in Norway, in Scandinavia, is the younger generations are now recognizing there is definitely a shift in the way they perceive a beauty, in a sense that the younger generations are now seeing, appreciating fairer skin being beautiful skin. So they celebrate that. They celebrate what a quintessential Norwegian would look like, i.e. with fairer skin, if you like. I know that, that phrase quintessential Norwegian is probably now politically incorrect, because what is a quintessential Norwegian? But you know what I meant. That so the younger generations Norwegians now celebrate the fact that fair skin can be just as beautiful as tan skin. So we're seeing this shift in culture, if you like, that fewer younger people growing up in Norway, particularly, or Scandinavia in general, would pursue aggressively a tan skin just so that they could look so-called healthy, I think. Whereas in the UK, that perception of I look healthier if I'm tan is still very much within the society, the UK society, I think.
That is wild. I think that the UK society is, I would say, 5 to 10 years behind the likes of Scandinavia. And this is just from being in these countries, and this is my perception. Australia, especially, they're actually borderline OCD about the healthcare of their skin because of the sun damage and because of skin cancer rates. And for some reason, we've adopted this mindset, or perhaps just inherited this mindset of it's healthy to have tan skin. Skin damage, how much can that age you? And what's the kind of technicalities behind it? So sunburn.
So you're going to be shocked by this statistic. So we have broadly two different types of aging. One is what we call chronological aging, i.e. genetic aging, right? So chronological aging is time that ages you. And then we have environmental aging, or anything that's other than chronological aging. Believe it or not, chronological aging only contributes towards 15% of the overall aging process. In terms of appearance, right? Appearance. We're not talking about deterioration of your organs and things like that. Not like that. So chronological aging only plays 15% only causes or contributes towards 15% of somebody's overall aging, physical as in appearance aging.
Yeah.
And the rest of it, the remaining 85%, is everything to do with our lifestyle and lifestyle choices. Our diet, sun exposure, alcohol, cigarette, so that's 85%.
Wow. And what can people do in terms of diet to benefit their skin and not reverse the aging process, but perhaps slow it down?
Well, you see, I was watching this YouTube video years ago, and it was Elle Macpherson, and understandably every time when somebody's interviewing her, one of the questions would invariably be that, what do you do to keep yourself looking so beautiful? You're already in your 50s, something like that. And Elle Macpherson back then, and I learned that from her, and she said every morning when she gets up, the first thing she does is she would walk into her kitchen, and she would then get herself a big pint glass of water, and she would drink that entire glass of water before she would go into her shower. And that's what I have been doing since for quite some time now. As I would wake up in the morning and I would switch on the shower, and it would take a few minutes for the hot water to come through anyway. I would then walk into my kitchen and I would pour myself a big glass of water, and then I would drink the entire glass of water. So drinking plenty of water every day, not once in a while, every day is a good start, because at the end of the day, the skin is the largest organ in our human body, and the skin evaporates moisture 24/7. So we are losing moisture through the skin. So hydrating the skin is definitely a good way to maintain skin quality and skin health. And sun exposure, minimize that as much as possible.
Yeah.
And then lifestyle choices like cigarette smoking, alcohols. Alcohol dehydrates the skin. Yeah. Well, us being in a cold country with a central heating system 24/7 running all the time, it also dehydrates the skin. And over a period of 30, 40, 50 years, so we are talking about cumulative damage, all of that when you put together can age the skin significantly. So use perhaps maybe body moisturizer to moisturize the skin. I know a lot of people don't do that. I don't do that too. But that's why a lot of women, predominantly women, they use body moisturizers, don't they?
Yeah.
Is to moisturize their skin continuously. So there are a lot of things we can do. I mean, we obviously won't be able to do everything because aging is just part of life, isn't it? We don't want to be overboard as well with trying to mitigate aging. But there are a lot of things that people can do just by having an awareness of what they can do in terms of lifestyle choices to help with the aging process. Not necessarily to reverse it or not necessarily to stop it, but to slow it down. But the thing is, if you think about it, maybe, and I would like to think a lot of people don't mind aging. There's nothing wrong with aging. There is nothing wrong with looking older and looking aged. So who are we to say that people need to do anything to slow down the aging process, isn't it?
Yeah, for sure. If you were to look at me, and I won't be offended, what do you think you would do to my face?
It's just, I think before we started recording, did I not say that you are one of those that I was saying to myself must be, genetically 120 years old, but look 25 years old. I think you've been blessed with just, great skin, just great anatomy that, if you were one of my patients at the age of 25, 26, I would say to you, celebrate, everything you've got. If it's not uncommon that I see 90% of my patients are women, as we discussed earlier, that if they are at the age of 25, 26, 27, and they are coming in for a couple of things, it's not uncommon that I would say to them, you think about people like Julia Roberts, Catherine Zeta-Jones. When they were in their early 20s, they were good-looking girls, cute-looking girls, but they didn't quite become the beautiful women they are today until they were in their late 20s or their early 30s. Because human anatomy continues to change, and although physiologically a woman will have been fairly matured physiologically after their teenage years, but physically, in terms of appearance, their appearance continues to change until almost you're in their late 20s. So if a patient was to be sitting in front of me 22, 23, 24, 25, 26, and they want quite a few things done, it's not uncommon that I would kind of remind them of the fact that perhaps maybe it's not a bad idea to wait.
Yeah.
Leave it for a few years. And then, perhaps reappraise if you are still uncomfortable with your physical appearance, and then come back to me. So I would say the same to yourself that, good skin, Scandinavian skin. Don't you think, Drew? Yes, Scandinavian skin.
Pale.
Good smile, beautiful teeth. I would say just celebrate that and be content with that.
Oh, you're making me blush. Listen, I know that you're on a time frame, and I don't want to let you leave, but I think I'll have to. We do have a closing tradition.
All right, okay.
And it varies from guest to guest. So I suppose the question for you would be, what is the most valuable lesson that you have learned within your career so far?
Right. Now, so since you use the word career, I remember just speaking to a colleague of mine at the start of my career, I was in surgery, so I have a surgical background. And I remember speaking to a colleague of mine about something that's not related to what I'm about to say. And he happened to just mention this thing to me that he said, as a doctor, or at the time I was in surgical training, so as a surgeon, the day when you let your guard down is the day you make mistake. And I think for my career, that's been a mantra that I have gone by. That every day, regardless of how repetitive some of the procedures may be, that a lot of people might potentially think Botox is Botox when you watch it on YouTube, that it's about pointing and shooting a syringe into somebody's skin. But to me, it's not, and it's a medical procedure, and I will never let my guard down, because the day when I let my guard down is when I make a mistake. So I would like to think that for my career, that has served me pretty well. And then what I always also keep in mind every day is, I graduated in 2003. I went to Glasgow University, and the day of my graduation, all of us, we took an oath, and when we were told that it's after the taking that oath that we were then pronounced as doctors. And I think I never let myself forget the fact that I took a Hippocratic oath that ultimately I'm a clinician. Ultimately, when people come to see me, and on a day-to-day basis, I'm a doctor. And that trumps every single thing, because I have a duty of care for my patients. Hence, I still refer to them as patients. I don't call them client, because as much as some people may think that due to the fact that it's a private practice, it's cosmetic, and there is transaction between the service provider and the person in front of us, and there is an exchange of money, that they are more suited to be referred to as client. But I never see them as client, because they are my patients. I am their doctor, and I have an overriding duty of care to look after them, and to make sure that that I perform to the best of my ability to keep them safe, and give them as good a procedure that is scientific and evidence-based, and yeah, ultimately I think it's the fact that I am a clinician, and I always keep that in mind. That trumps everything.
For sure. Well, thank you so much for coming in. That was amazing. Well done.
Thank you very much for having me. Thank you.
No, yes. Thank you. Oh no, I didn't look at my piece of paper once.